On beginning of part 2, remember to click on subscribe, and then we continue on formula feeding after birth. If breastfeeding isn't an option, here's how to safely and confidently feed your baby formula. Choosing formula. Use an infant formula recommended by your doctor. Most formulas are cow's milk based but modified for newborns. Step-by-step guide. Prepare the formula. Wash your hands and sterilize bottles, nipples, and feeding equipment. Follow the instructions on the formula package, e.g., how many scoops of powder to mix with water. Feed your baby. Hold your baby in a semi-upright position. Tilt the bottle so the nipple is filled with milk to prevent air swallowing. Feed slowly and pause to burp every few minutes. Feeding amount. Newborns usually take 1 to 2 ounces, 30 to 60 milliliters, of formula per feeding every 2 to 3 hours. Watch for hunger cues and let your baby guide you. Formula feeding tips. Always test the temperature of the milk by dripping some on your wrist. It should be warm, not hot. Discard any leftover formula after feeding. Don't reuse it. Don't prop up the bottle. Always hold it to avoid choking. 3. How often should a newborn feed? Newborns have tiny stomachs and need frequent feeds. Breastfed babies, every 2 to 3 hours, 8 to 12 times in 24 hours. Formula-fed babies, every 3 to 4 hours. 4. Burping after feeding. Babies swallow air while feeding, so burping helps them feel comfortable. How to burp. Hold the baby upright against your chest or over your shoulder. Gently pat or rub their back until they burp. If they don't burp after a minute, it's okay. Try again later. 5. Signs of hunger and fullness. Hunger cues, rooting, turning their head with an open mouth, sucking on their hands or fingers, smacking lips or fussing. Fullness cues, turning away from the breast or bottle, falling asleep during feeding, relaxed hands and body. 6. General tips for first feeding. Stay calm and patient. Feeding is a learning experience for both you and the baby. Ask for support from a nurse, midwife, or lactation consultant if you're unsure about breastfeeding or formula preparation. Remember, your baby's stomach is small, about the size of a cherry on day 1, so don't worry if they don't take